the women out there, if you've been experiencing uncomfortable, heavy periods, pelvic pressure, or pain, you might have fibroids. Today, we're breaking it all down. This is What's Up, Doc, Fibroid Edition. And to give it to us straight, we've enlisted the help of board-certified OBGYN, Dr. Lisa Nicholas. Welcome to the show.
Thank you for having me.
Okay, first of all, please explain to us, what are fibroids?
I'd be happy to do that. Okay. Fibroids are benign, non-cancerous tumors of the uterus. And they're derived from muscle cells. And actually, they can have a large spectrum insofar as their size. They can be as tiny as a pea or even a mustard seed. They can grow into a lemon size, an orange size, a grapefruit size, a cantaloupe size, a watermelon size.
Wow. People can have a watermelon-sized fibroid chilling all up in there.
Yes,
they
can.
That's a full baby.
Yeah. Yes, indeed. And that's sometimes people feel like they're pregnant, actually, when there actually is a fibroid.
Wow. How long does it take for, a mustard seed to grow to a watermelon?
Well, it could take an extended period of time, or sometimes it's a short period of time. It's unpredictable.
Okay.
What are the symptoms of a fibroid?
Well, there are several symptoms, Lonnie, that women may suffer from uterine fibroids. But one thing important to know, they may not have any symptoms whatsoever. But the most common symptom that we see is abnormal bleeding. Very, very heavy menstrual periods. Periods can last up to 1 to 2, 3 weeks at a time.
Oh, geez.
That can have a resultant anemia, where they're constantly fatigued. Yeah. They could never think about wearing white pants or any kind of slacks that would be revealing. In addition, you have pelvic pressure, frequent urination, constipation, painful intercourse, and just feeling like something's growing inside of your abdomen that is like a pregnancy.
Wow. How common are fibroids?
Well, that's an interesting question. Fibroids are very, very common. They estimate perhaps 1 in 2 women actually have fibroids, and you look at that. And that's pretty a common entity.
So 2 of us have chances of having it.
Absolutely. And the interesting part about it, we can't predict which women will have it, and we don't know why women have this problem. But there are a few things that we do know. It seems to run in certain families. There may be a genetic factor, and it seems to be more common in women of color, of African-American women.
But they don't know why.
They don't know why. We're doing research, we're doing studies, and we're looking at various things like diet, stress, lifestyle, all those kind of things. And interestingly enough, there was a study done in South Africa where they looked at white women from South Africa and black women from South Africa, and the black women still had more.
They had more fibroids.
Wow. That's weird. Okay, so now if you get them taken out, what options do you have?
Well, there's several different options that we have if we do a surgical approach to manage the fibroids. First of all, there's a hysteroscopy. A hysteroscope is a small cylindrical instrument that you can insert through the vagina and look into the cavity of the uterus and actually identify the fibroids and extract them that way.
Okay.
That's considered a minimally invasive surgery. So you can come in on Friday, have the procedure, kind of chill over the weekend and go back to work on Monday.
Okay, that's cool.
So that's hysteroscopy. Then there's laparoscopy. That's the belly button surgery or the minimally invasive surgery. So we can remove fibroids from that methodology as well. But it's very important that we know that there's not any chance of it being potentially cancerous because actually we crush up the tissue and suck it out through an instrument and send it out to the lab. Once again, patients do very well with that. We can do the procedure on a Friday, recover over the weekend, and back to work on Monday.
Got it.
Then there's more extensive surgery where we actually have to open up the patient extensively, such as what we do for cesarean sections, a bikini cut. And that's called an abdominal myomectomy. And that requires a little bit more recovery time, perhaps being off of work for about a month.
If the fibroid is bigger.
That's right. It's very hard to remove very, very large fibroids through the laparoscope. And then last of all, and that's the procedure most women are fearful of, is the hysterectomy, where we actually have to remove the uterus.